I have a patient who came in. She came into the emergency room because she has and she's having a difficulty breathing. And then she came in with his brother and his mother because the patient is nonverbal, so she really can talk to us. And then as we provided care and we stabilized the patient, I noticed that the the mother of the patient and the brother was like really uncomfortable on their chair, and it's like, and then the mother is always like doing this, and because emergency room is always very cold in the emergency room. So what I told them, are you okay, ma'am? Do you need anything? Do you want me to provide you a warm blanket? And then they were actually wanting to have a warm blanket, but they're just so shy to ask one. So
Mm.
I took the initiative to ask them if they want one, and then I provided it to them, and then they were very thankful. And then I even asked them, because we had a little coffee machine in the emergency room. I even asked them if they want coffee, and yes, they said they were very thankful, and I made them coffee. I even provided them some cracker, because I believe that when you take care of a patient, it's not only the patient, but you also have to be supportive and take care of their family. Especially, there also can be an added support on taking care of your patient. So that's why I did.
Yeah. Okay, perfect. If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel if you use the discount code YouTube. It's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube.
We had a little girl coming in for lobectomy. And the family was just going through treatment with that. And we took her in, we admitted her. And I think the family was having a really, really hard time. So whenever I had extra time, I just popped in to really talk to the family, because I felt like they just wanted someone to talk to and express their feelings to. And I really just made sure to just ask them how are they doing, asking if there's anything I could do to make them more comfortable. And I just wanted to ask about their experience, because they wanted to kind of just tell me about, just their journey up until this point. So yeah, I just gave them an opportunity to express their feelings, express like the highs and the lows with having a child with this disease, maybe just the issues that they've encountered along the way, and like their wins and losses. And I think I spent a total of like an hour and a half in there, like doing cares and just listening to them and talking to them. But at the end of the day, the family just expressed how thankful they were to me and how like cathartic it was just to like talk about the situation with somebody who kind of like understands. Like, obviously I don't have a child, and I don't have a child, so I can never like truly completely know how they feel, but just, someone in medicine who understands like, how hard it is to have a child, like, how hard it can be for children to be sick, and, how difficult the toll it takes on the family. So I think just having someone there who they knew they could turn to and it was in their corner and would advocate for them and listen to them really made a big difference in their stay. And they said that it made the scariness of the lobectomy a lot less scary. So it was something small that I was able to do, but it really made a big difference to them. And it really showed me that just doing something small like that really does change your patient's experience, and helps them know that you are walking alongside of them and that they don't have to go through this whole situation alone, and that their child is in good hands.
I had a patient come in and we weren't sure what was really going on, but we called a code stroke and we did a full stroke workup, and then the doctor ordered a Foley catheter. So at the time, the husband was also in the room and he was kind of informing everyone of what was going on, and he was just very confused. So we told him as much as we knew. I sat down with him and explained the whole process on the whole stroke workup, why they were taking her blood sugar, why they were doing different assessments. And then I also told him about a catheter, how that we did a bladder scan. Her bladder scan was, so I told her husband, so she's retaining her urine, and that means that her bladder's super full. So this catheter, it's a little tube that goes straight up her urethra and into her bladder, and this is just going to help relieve all of that pressure, and it's going to drain all of her urine out. And he said that, like, he was very thankful for me to take the time to sit down and actually explain to him what was going on, because it was a very stressful situation at first with many people in the room, and me taking the time to explain that to him made his anxiety go down, and he felt very grateful that his wife was in good care. And upon inserting the catheter, I was inserting the catheter into the wife. I noticed that the wife was super scared. She was ANO times 2, but she just felt very nervous about what was going on. So I remembered that her husband told me that she loved Elton John. So we played some Elton John. All of us were singing Tiny Dancer in the room, playing the Elton John in her ear during the Foley insertion. And she was also singing along. She remembered the lyrics as we were inserting the Foley. And I don't really know what else to say. Like, that's just like a story about like a patient. That's the last one I remember. It was like with the patient and then also the family member. But I don't know how to like make that sound like or meet what they need to meet.
Was he involved at all in the Foley insertion? Was he like holding her hand or like anything like that?
Yeah,
Or
he
no?
was there. Yeah, he was holding her hand. There was
And his job was to kind of like explain to her because he knew kind of how to manage her. Is that right? Like she kind of relied on him for that.
Yeah, she was ANO times 2. We didn't know why. Like we thought it could be a stroke, but we didn't know. And then he was just kind of there. Like she knew who her husband was, and we think she knew where she was, but I don't think she really understands what was the time or anything like that. She was able to like say a couple words and like blink, but she definitely recognized her husband. She was like humming. She knew like the song. She knew her husband, and I think that she knew what was going on when we were talking to her. You could just kind of tell, like she was nodding.
You could have the focus be a little bit more on the fact that she was confused and she was anxious, and that he realized it would be helpful if he could be there holding her hand and understanding. Obviously you will explain to her what's happening, but when she's like forgetful, that she kind of kept turning to him, wanting him to explain. He didn't understand it super well, so you were explaining it well to him. And then you let him tell you guys what music she liked, and he was able to hold her hand to kind of keep her hand out of the sterile field for the Foley insertion or